Good evening. My name is Peter Devereaux, and I'm a psychotherapist at My Therapy, New York City. We're a private group practice located in the Flatiron neighborhood of Manhattan. Today, I'd like to talk to you about narcissism, how to understand it, how to recognize it, as well as how to respond to it. You can feel free to type any questions you have in the chat box for the Q&A at the end. Those questions will only be visible to me. If you'd like to keep the conversation going, you can follow us on Twitter at My Therapy New York City and use our hashtag MyTherapyChat to share any of your insights. Also connect with our attendees. Wherever you are, take a moment to slow down. What I invite you to do right now is think of a time recently when you found yourself frustrated, feeling as though someone in your life was making everything all about themselves. Who is this person? What did you feel? What came up? Now take another moment to notice what you're thinking and feeling as you recall the experience. You might have noticed that you felt some discomfort, maybe even some anger came up, and that's all okay. I just want you to notice it because we all have people in our lives who we find challenging to connect with, who may create feelings of hurt and frustration. With that in mind, we're going to talk about a set of traits that many find particularly hard to deal with. For today's discussion, I've broken this presentation down into 3 sections. Number 1, what is narcissism? Number 2, how to recognize unhealthy narcissism. And number 3, how to cope with and respond to the effects of unhealthy narcissism. By now, most of us have heard the term narcissism and narcissist tossed around in conversation. Maybe we've even used it on occasion to describe ourselves or others. Most often, people are making reference to someone who is excessively self-absorbed, selfish, self-centered, or self-important. These are traits that exist in all of us. Narcissism occurs on a spectrum and is not, in and of itself, a disorder. I'll go through what that means a little bit later. Bear in mind that it develops as part of a normal developmental process which begins in childhood. Our levels of narcissism can vary throughout the course of our lives. In its most extreme form, it's a psychological disorder in which you are overly focused on your own needs at the expense of those you are in relationships with, ignoring or minimizing their needs. The difference comes down to the fact that with unhealthy narcissism, people get hurt. The term narcissism comes from the story of Narcissus and Echo. In Greek mythology, Narcissus and Echo lived together in the woods. Beautiful young Narcissus fell in love with his own reflection in a pool of water. Unable to look away, he wasted away and died. Narcissus was overly self-absorbed. Echo, a mountain nymph, taken by the beauty of Narcissus, died after spending her lifetime trying to get his attention. Her love for him was unrequited. Echo was overly other-absorbed. Focusing solely on Narcissus, she neglected herself until she withered away and died. So I mentioned earlier that narcissism exists on a spectrum, so let's go over that now. The narcissism spectrum includes extreme narcissism. The narcissist is entitled, manipulative, and self-seeking. They may view themselves as better than most others. They may struggle to give and receive emotional support. The primary purpose of the world around them is to meet their needs. Their sense of entitlement means those around them are expected to bend to their will. They may have an empathy impairment, which means they're not able to access feelings for other people. Impairment means that it fluctuates as they come in and out of their preoccupation with their own experience and their needs. Next, we have healthy narcissism. This is genuine pride and self-worth. Here we have the ability to empathize and relate to others. We can admire and be admired. These qualities afford us the opportunity to relate securely with others and engage in mutually rewarding interactions and relationships. Lastly, we have egoism. That really is the complete lack of healthy narcissism. We tend to have low self-esteem, codependence in relationships, and often experience depression and emotional distress. The narcissistic personality has an uncanny ability to identify folks with egoism, identify their low self-esteem as an opportunity for control. Now I'd like to discuss what it really means for someone to have narcissistic personality disorder versus narcissistic traits. According to the DSM-5, research estimates that NPD occurs in up to 6% of the population. Of those diagnosed with NPD, 50 to 75% are male. My recent video blog contains an explanation of narcissistic personality disorder, along with its diagnostic criteria. We're going to take a look at that video now. Narcissistic personality disorder, also known as NPD, is one of a group of 10 types of personality disorders. NPD can only be diagnosed by a qualified healthcare professional. In order to receive a diagnosis of NPD, they will have 5 or more of the following characteristics. Number 1, a grandiose sense of self-importance. It's that person who feels like they're the most important person in the room, and you find yourself giving them all of your attention. Number 2, a fantasy and preoccupation with unlimited power and success. It's that person who is constantly talking to you about their dreams of being rich and famous. Number 3, the belief that they are special and unique and can only be understood by other high-status people. For instance, that friend who's always asking for the manager at a restaurant, rude to waitstaff. Number 4, a requirement for excessive admiration. Things are usually going really well so long as you're providing them with admiration and approval. However, as soon as you express any kind of criticism or lay down a boundary, a conflict usually arises. Number 5, a sense of entitlement. They don't believe rules or laws apply to them. For instance, that friend of yours on game night always seems to win by cheating. Number 6, interpersonally exploitative. This may be that friend who's always around so long as it benefits them, but disappears as soon as you might need them. Number 7, an impaired sense of empathy regarding the feelings and needs of others. This may be that person who you dated who acts surprised when you are hurt or upset about something that they said or did. Number 8, envious of others or believing that others are envious of them. This could be that friend who always feels that people are jealous of their successes. Number 9, showing arrogant or snobby behaviors and attitudes. This could be that friend who always comes across as very smug. It's important to mention that these defenses are based in the human drive to feel special. Narcissists are dependent on feeling special in order to regulate themselves. So a bit about those defenses. These evolve as defense mechanisms against abuse and neglect. They're developed in order to combat threats to a fragile and unstable self-esteem. So now that we've explored these different traits, let's look at the different types of narcissism that have been classified. We have 3 types. The first type is the extroverted type. They can be the life of the party, easily climb the corporate ladder, and win you over with their charm. They are often superficially extremely skilled socially. They can dazzle you in conversation. The next type is the introverted type. They are also referred to as vulnerable, covert, or hypersensitive narcissists. They may appear reserved, wary, or timid, yet feel wholly unique and superior. The third type is the communal type. They're less focused on extraordinary achievement or status, but instead regard themselves as exceptionally nurturing, empathetic, or understanding. Now that we have a better understanding of what narcissism is and how it originates, we want to turn our focus now to some of the warning signs of unhealthy narcissism. In his book, Rethinking Narcissism, Dr. Craig Malkin offers helpful tips for recognizing unhealthy narcissism. He describes 5 warning signs. Number 1, displaying emotional phobia, a strategy to avoid experiencing any feelings of vulnerability or to keep from showing it. They may mask insecurity by envisioning themselves as unaffected and independent. Again, this is a defense mechanism. They may react with anger and condescension in order to hide how affected they are feeling. Here, their main goal is to react with such intensity as to distract and deflect from the fact that you are affecting them. They may change the subject when you share vulnerable feelings, such as fear or sadness, which may remind them of their own fear and sadness. Another tactic narcissistic personalities use is planting seeds of uncertainty, commonly referred to as gaslighting. We have a video now, short video on gaslighting I'd like to introduce. It's by Dr. Ramani, a psychologist here in New York City.
What does it mean when somebody, particularly a narcissist, is telling you you're being overly dramatic, you're being overly sensitive? I know some of you already know the answer. It's gaslighting. Now, a lot of people, when they think gaslighting, it's the big ticket stuff like, that never happened, or you have no right to feel that way. But when somebody calls you too sensitive, they are actually doubting or questioning the validity of your emotional reaction in a given situation. When they tell you you're being overly dramatic, they're doing the same thing. It's almost a form of shaming, because remember, the narcissist is driven on shame. They hate it, they're afraid of it, so what do? They try to sort of cause it in other people. And so by saying you're being too dramatic, you're being too emotional, it's not only a way of sort of shaming you, it's telling you your emotions aren't valid. And it also becomes a chance for them to almost get this upper hand once again and try to control the emotional temperature of the situation. Just to revisit what gaslighting is, it's when a person literally doubts the reality of another person in such a way that it leaves the other person confused, invalidated, just honestly upside down, as it would if you went outside and somebody said, hey, look, the sky is purple, and you're looking it up and I think it's blue, and they say, no, the sky is purple. So this is that sort of sky is purple idea that you are being too sensitive. Some people don't understand it as gaslighting, but it takes in that territory. And as I've always said, and any of us doing this kind of work will say, gaslighting is a form of emotional abuse.
Now for warning sign number 2, playing emotional hot potato. Here, the individual projects their emotion onto the other as a way of disowning it. They attempt to manipulate the other into experiencing uncomfortable emotions that they want to avoid. Next, we have number 3, exerting self-control. Here, the individual arranges and plans events to get exactly what they want. For example, they may tend to be overly focused on setting up plans with you that actually help them kill 2 birds with 1 stone. They cancel plans when you've made the plan and ignore your suggestions. For instance, after perhaps agreeing to a plan, not showing up or getting stuck at the office when it's something that you'd suggested or that you're interested in. This reminds me of a client of mine reporting that his partner would frequently get stuck at the office when the plans were to see his family or friends, or to see a musical or a show instead of a sporting event that his really partner would have been preferred to be seeing. Next, we have number 4, placing people on pedestals. Here, the individual idealizes others to increase self-esteem by association, eliminates imperfections as opposed to creating intimacy by looking past them. This is bringing up a client of mine, has a history of idealizing romantic partners, friends, and bosses, actually, but then being shocked and disappointed when they show themselves to be human and not perfect. She learned through treatment that the purpose of idealizing those around her, not allowing herself to see any of their imperfections, was a strategy she was using to feel special and to feel better about herself. If they were extraordinary and wanted to associate with her, she would also then have to be extraordinary. Number 5, fantasizing that you're twins. Here, the individual creates a flow of validation by creating a mirror image of themselves in the other. This eliminates any fear that there are differences between the two of you, ultimate security and approval. Narcissistic traits and tendencies can manifest in and infiltrate any relationships that we have. Earlier, I asked our live participants to take a poll. The question was, in which of the following areas do you feel you've struggled with someone who may have narcissistic traits? Number 1 was family. Number 2 was friends. Number 3 was romance. Number 4 was the workplace. So let's review your responses. From what I see through our responses, 29% of you responded that it was family. 12% of you responded that it was friendships. 24% of you responded that it was romance. And 35% of you indicated that it was in the workplace. And that again could be colleagues or your boss. Now that we know what narcissism is, along with some narcissism warning signs, let's take a look at what we can do to manage our relationships with narcissistic and other difficult personalities. Strategy number 1, acceptance. Acceptance is a crucial first step. Here you will need to see the relationship dynamics for what they are. Learn all you can about narcissism. Drop the denial and the minimizing of the other's behavior. This does not mean, however, that you accept being abused or manipulated. I think that's very, very important to note. Lower your expectations of the other. Align them with the information that you have. Last, grieve any illusions or unrealistic hopes for the relationship. Next, we have increase your awareness. Observe their behavior, observe your own behavior and experience. Take a careful look at their words, their behavior patterns, and their actions. Then take a close look next with your own emotional and behavioral responses. The next strategy we have is to detach with love. Here we switch from dwelling on the behavior and reactions of your partner to the only things you truly can change, which are your own feelings, your own beliefs, and your behaviors. Focus on understanding their cognitive and emotional limitations. Again, this goes back to educating yourself on narcissism and understanding what's really going on. Practice compassion for the suffering that underlies their difficult traits. Next, build your own self-esteem. To do that, it's important to set and pursue your goals. Develop self-acceptance and self-compassion. And most important, stay true to your own values. The next strategy we have is to change your reactions. To do that, it's really, really helpful to practice responding instead of reacting. We do this in order to engage more effectively and help feel we're more in control with our emotions and behaviors. Reaction is more of a sort of a knee-jerk emotional response, whereas response is more of a rational, thought-based behavior. Next, we have the gray rock method. The gray rock method is a boundary setting technique to facilitate detached contact when a survivor and an abuser come into contact. Imagine yourself becoming emotionally unresponsive, cutting off their narcissistic supply. Make yourself impenetrable to their chaos and drama. You may sometimes find yourself in relationship with a narcissistic personality whom you cannot easily cut ties. For instance, when that individual is someone you co-parent your children with, or perhaps it's a boss or a colleague at a job you're not yet ready to leave. Becoming a non-reactive gray rock can be an effective technique in neutralizing that interaction. Next, we have assertiveness. This is important to focus here on a discussion of boundary setting. In order to do that, we need to clearly identify and communicate what behaviors you are willing to accept and what behaviors you are not willing to accept. Have an exit plan. For example, drive your own car to events, or make sure you have a car service app or a phone number handy so that you don't have to rely on somebody else to help get you out of a situation. Quickly and decisively respond with asserting the boundary when necessary. Good boundaries always include the consequence. Again, remember, you have the right to remove yourself from any unhealthy interaction with any person at any time. The client I discussed earlier was working in therapy on establishing boundaries and changing the way she interacted with her mother. In order to do that, she began with interacting with her mother in using the gray rock method. When her mother would become argumentative or start calling her names or even raising her voice, she changed the response and started just becoming neutral, not responding at all, not engaging in the back and forth, and as those interactions had previously escalated. She decided to draw a boundary with her mother and explain to her that if she were to be expected at a holiday dinner, there was going to be some ground rules. Those ground rules would be if her mother became argumentative, raised her voice, started calling names, she would have to get up and leave, regardless of whether the dinner was finished. Her mother was able to respond to this and regulate her own emotion so that when her daughter was visiting, she maintained a calm and respectful demeanor so that the client was able to enjoy a peaceful holiday dinner and the family was able to all get together and enjoy the holiday. It's important to note here that if none of the previous strategies feel like an option, you might want to consider going no contact. What that means is avoiding any face-to-face contact whatsoever. Here, it's important to make sure you let supportive others know that they can support you in avoiding situations where you might run into the individual. If someone you are friends with is having a party, it's important to maybe inquire with them as to is a particular individual that you've established a no contact rule with going to be there. Let them inform you in advance so that you can make a decision around maybe not attending. Block phone numbers to avoid text messages and phone calls. Next, it's really important to block on social media for two reasons. It's important both to block them from contacting you. It's also really important to ensure that they don't view your activity and your engagement with others. Lastly, what we always want to keep in mind is that self-care is crucial. In the beginning, in the middle, and in the end of this process, it always comes back to self-care. There are some really, really effective ways to organize our thoughts around self-care. The first action that you can take is to engage in psychotherapy if you're not already engaged. Professional support can really help you understand where your loved one's behaviors are coming from, understand how you're responding to it, and help you develop a strategy in order to perhaps change the relationship. Meditation and mindfulness. Reduce stress. This can help you cultivate the skills needed to help you respond, again, rather than react. Working out is an important way to reduce stress and improve your self-confidence. Journaling. This can help you process and organize your thoughts. It's also really, really helpful for you to take a look back at a certain point and notice your progress, notice all the gains you've made and all the ways you've improved your relationships with some difficult people in your life. And lastly, socializing with friends and family. Again, being connected to other people who are supportive of you, who do affirm you, who do validate you is crucial. And it's always important to remember to go where it's warm, go where people are treating you with respect. And lastly, I think we're ready to move on to our question and answer period. Okay, let me check the sidebar and see what we have. Okay. So the first question I see is, what if I have a partner who is repeatedly crossing a boundary? Is there an extra measure or step you suggest to make my boundaries firmer? So there does come a time when very direct, explicit communication is necessary, and this is obviously one of them. A helpful strategy for dealing with repeated boundary crossings is the establishment of something that we call a connection contract. So a connection contract involves getting really, really specific with that person about what the behaviors are that are not acceptable, and what's going to happen, what is going to be the specific consequence in response to those behaviors. So basically, you're going to be giving a statement to them and establishing a procedure. If you do this, I'm going to have to do this. For instance, I had a client once who had a father who continually embarrassed him in public. He was really, really proud of his accomplishments, and he bragged about his son while his son was sitting was in front of other people, and he basically explained to his father after one really uncomfortable interaction that if the next time you do that, I'm just simply going to get up and I'm going to leave. And that's what we really call a connection contact. In order for us to go out to lunch, I need to ask you not to brag about me to the server. And if you do that, I'm going to just end the lunch early. And he found it really, really effective. Next, we have, should I call a person out or confront them on healthy narcissism? So this is complicated because a direct confrontation could potentially be received as more of an insult. So there is a lot of potential that an individual could become defensive and really unreceptive. So what a more effective tool might be to use would be to catch them in those moments when they're demonstrating empathy, practicing, connectedness, so that you can start, explaining to them when they show care and concern that it resonates with you. And so that the more that they can see that you are responding positively to their behavior, which is positive, they can understand that relationships can be dependent on. And perhaps I would imagine that they would be less likely to turn to narcissism in order to feel special. Let me see here. We have a question. Are there ever times when people just need to separate immediately? Yes. Dr. Malkin refers, actually, in his book, Rethinking Narcissism, he refers to some of these issues that are real non-starters as stop signs. If you're in a relationship with someone who's physically or emotionally abusive, even if they're in active addiction, that it's really comes to a matter of the question is your safety. Your safety comes first. So in a situation like this, you really need to seek the assistance and professional support of a trained mental health professional in order to make a plan to leave. But if it feels like you're in imminent danger, you have to leave immediately or call 911, actually, and get emergency medical help. I would say another reason that you would want to just leave immediately and stop strategizing would be when someone is completely unwilling or unable to acknowledge that there's something wrong. Obviously, if they have no regard, no insight, and they're refusing to even acknowledge it, things are not going to get better. So you're probably going to want to just develop an exit plan. And I'd say the last one is in the real extreme, remorseless lies and deceit. And this is a basic situation when there's no fluctuation, there's no impairment in empathy. So there really is no opportunity for you to work with them on improving the relationship. So it could be a sign of extreme narcissism that can actually become dangerous. So it's really important for you to just immediately decide how to get help and how to get out. The last question we have is, narcissism may be one of the only mental disorders where the patient themselves are not treated. Their narcissism causes anxiety and depression in the people around them. And it is those people who are more likely to be diagnosed and treated for said anxiety and depression. How do we change this so it's easier to treat the narcissist so they do not cause so much damage around them? Again, because narcissists or people with exhibiting narcissistic traits do have impairments in empathy, I think it's really, really important technique to use, again, recognize when they are exhibiting empathy, when they are exhibiting some sort of attunement to you. Recognize it, point it out, call it out, and support it. And hopefully that individual will learn that there are other ways to be close to you, other ways to feel positive self-esteem in and of themselves, so that they can learn sort of a way to strengthen that aspect of themselves. Okay, so those look like all of the questions that we have for today. So I just wanted to thank you for joining me this evening for this webinar, and I hope that you found it informative and that you've been able to gain a better understanding of narcissism, narcissistic traits, and strategies for dealing with narcissistic traits. Our therapists here at My Therapy NYC work with individuals and couples, and we also run groups. And recipients are going to receive a recording and a list of resources following the webinar. And please feel free to use the hashtag MyTherapyChat to continue the conversation following the webinar. Feel free also to send me any of the questions that we didn't get to, or any questions that might come up afterwards. The email address you can use is info@mytherapynyc.com. So again, thank you so much, and I wish you a pleasant evening. Thank you.